All right. Well, today here we have Mr. Ryan Broome. He is a journalist and television broadcaster on the island of Barbados. Thank you for joining us here today on You Talk It, We Live It. It's a podcast by and for working people. I would like to discuss with you the impact of COVID-19 in Barbados. But first, let's set the stage. Pretend I have never been to Barbados and have simply only heard about it in terms of an island I should absolutely get a honeymoon in. So, can you tell us a little bit about Barbados?
It's the next closest thing to heaven that you can find. I always tell people, I'd like to say I live where you will want to vacation. That's perhaps the best way to put it. You wake up, I pretty much get to the beach almost every morning, even though I don't live close to the beach. I still get to the beach almost every morning. They have the typical things, sun, sea, and sand, but we are also pretty advanced in terms of technology as well. We're one of the few countries in the Caribbean that has some of the fastest connectivity speeds in terms of both mobile and broadband, home broadband, business broadband. And yeah, infrastructure wise, you would feel that at times we've been called Little England, but you would feel at times that you're in Little America. This is some parts of Barbados look a lot like some parts of New York that you would see, and then there are the parts that are that typical Caribbean scene. You're driven past the beach, etc., etc. Yeah, just one moment, please.
It sounds beautiful and wonderful. And after this, as soon as my winning lotto check comes in, I am booking a trip because I need that sun, sand, and relaxation. How does infrastructure work for healthcare? Here in the United States, our healthcare is all over the place. It is top of the line and completely missing. And you can have that in the same states and in similar radiuses. So I never know what to expect when I look in other parts of the world. We
Mm,
know places like Cuba can have really amazing healthcare
mm.
systems, which would
Right.
surprise a lot of Americans. How does Barbados compare to places like the US, Canada, or England that many viewers may be more familiar with?
Well, healthcare here for the most part is free. Um, for most citizens, basic healthcare is free. And which is something that you don't really find a lot of other places around the world. Uh, Infrastructure wise, we have a major hospital, the Queen Elizabeth Hospital, that actually is interestingly enough, in terms of this particular COVID-19 pandemic, it's not being used at all to treat COVID-19 patients. We set up a separate facility in St. Lucie, which is the northernmost part of the country, where that is the treatment facility for COVID-19 patients. But our major facility, health officials decided that they would kind of insulate that against any contact with COVID-19 patients. So it's continuing to see doing the regular surgeries and all the other normal things that you would do at a hospital. And they're screening people actually to make sure that nobody who has COVID-19 is able to breach that outer perimeter. So, and then we have what we call polyclinics as well around the island. There are 11 parishes, and you would typically find at least one polyclinic in each parish. And those are like mini hospitals, really. And those help to handle some of the load that would normally go to the major Queen Elizabeth Hospital. And again, you would get your basic healthcare in terms of the very basic stuff. Obviously, not major surgeries are not free, even though to some degree, but all the basic medical treatment that you would expect to get, those things a typical Barbadian would be able to have access to without
Yeah.
insurance. Without insurance.
Yeah, that that sounds really nice. As somebody who has gone over emergency management, disaster preparedness through programs here in Oregon, I really definitely love the fact that you guys have set up these separate locations, because transmission, even when you cordon off a part of a hospital, it is still possible. Mistakes will happen. People
Yeah.
are flawed, and the more separate you can make these places, where you have as many barriers. This is all over there. Then you can keep your main hospital protected, I think, more completely than any other versions that I've seen out here. So I have to just give you guys a lot of props for that, because that is, I think, a gold standard for how to manage, pandemic. How has it impacted people in their day-to-day lives when this came through?
Well, that was interesting. Barbadians are known to be, or Barbadians, as we're also known to be very sociable people. We like what you call a lime, which is a mini party and so on. Nighttime limes, daytime limes. So people are where there's music, where there's food, where the gatherings. Actually, we did have a national event to celebrate 2020 this year that was called We Gathering. Funny enough, and that had to be halted at the end of March. That was supposed to be where we have 11 parishes, and it was supposed to be pretty much a major set of events in each parish throughout the year, with one major culmination in December. And then, ironically, we had a situation where we had a pandemic that caused you not to be able to gather, and so that had to be halted. And so it did cause quite a bit of disruption to life, not just life, but jobs as well. I think we saw our highest number of unemployment, or the highest level of unemployment claims were at like 40,000 up to, I think, last month. And it's going down now because actually from Monday, we're going back into pretty much full, fully open. Up until now, places like gyms have been closed. Um, I think spas have been given limited operation, just pedicures, but not skin contact. Uh, so, and minibuses and buses and so on have been restricted to half capacity, only seating passengers, etc. But now from Monday, you're going to see a reopening of gyms again and some other facilities, in addition to the supermarkets and the restaurants that are now open. And the restaurants can be allowed to have a few more people indoors, because it was just curbside and pickup, drive through before. But now they're gonna have some people inside dining as well. Limited, obviously, social distancing, physical distancing being observed. Um, but I think a lot of people are looking forward to Monday, because it's again, it's an opportunity for people who've not been working to start back working. Another one of the areas was daycare centers. Daycare workers have not been working now for about 3 months, and they're not going to start back from Monday. They're going to start back from the 22nd, because they want to give them an opportunity to get acclimatized. Obviously, you're dealing with children, so you want to make sure everything is as safe as possible. But technically, from Monday we go back into almost back to normal. There's still a curfew from Friday to Sunday, but curfew hours won't apply from Monday to Thursday. So curfew is 10 to 5 from Friday evening to Sunday, 10 p.m. to 5 a.m. But then from Monday to Thursday, there are no curfew hours.
So, we hear a lot about, people are opening back up. There's a lot of excitement about that. But has there been a lot of talk of how to protect against the second wave, or concerns about a second wave, which is very, historically speaking, for pandemics, and you can see this looking at the information for the 1918 Spanish flu, that, you have this quarantine period, and things drop, and then things open up, and particularly like, and we've seen this here in the US, when there is a big rush to
Mm-hmm.
get that everybody out, everybody's mixing, then you end up with all people more sick, and that second wave can end up being worse than the first wave.
Yeah.
How is that possibility, playing out in Barbados?
Well, I think one of the things that the health officials have kind of looked on here as a positive is our number of cases versus our recoveries. So, for example, to date, I think we have, speak subject to correction, 96 cases in all. Of that, we have, I'm trying to give you some exact numbers. But we basically have, oh yeah, I have the most recent one here. Right. Um, so it is. Just getting what they call the dashboard.
I'm gonna look up a little
All
bit
right.
information here real quick
Right. Okay.
myself.
So it's
Mhm.
96 confirmed cases, 52 females, 44 males. The age range 7 to 95. We've had 7 deaths in all. Right now, we had 83 recoveries. 6 people are currently in isolation. And of those 6 people, 4 of them came in recently on a flight from New York and, well, that went to both New York and Miami. So before that, we would have essentially had just 2 people, technically speaking, who are online on island confirmed to have the virus. Now, obviously, you can't always be sure that those 6 people who are there now are the only 6 people who have it on the island. But we've done for an island of 289,000 people roughly.
That was what I was checking too. I was like, what's the
Yeah,
population so we can get a comparison
we've
there. So
done
thank you.
we've done about 6,449 tests. For this part of the region, that is significant because a lot of our brothers and sisters in the Caribbean they're averaging around 2,000 tests, and some people have larger populations than we do. So I think what came into play in terms of the decision to almost well fully reopen is the fact that we have 6 people, technically speaking, who are confirmed to have COVID-19. They're in isolation right now. We're still doing testing every day. I think we test on average probably at maybe some days it goes down, but on average you could say maybe 75 people per day on
Mhm.
average, maybe that we're doing tests. And I guess when they look at all the numbers and the risk factors and the fact that we went before those 4 people came in on the JetBlue flight a couple of days ago, we were on, I believe, 18 straight days without any new cases,
That's
any reported
awesome.
cases. And well, I mean, the thing is that you have Barbadians who want to come back home. So we're gonna have a situation where, you're gonna have to allow flights in to let those people come back home, whether they're here in the region in the Caribbean or coming from the UK, the US, wherever around the world they are. And there's always that likelihood that some of those people, a few of them, hopefully, or none, would
Hopefully
have
none. Yeah.
COVID-19. In this case, this was a flight with 100 and I think 78 people, and on that
Mhm.
entire flight, everybody was tested. 4 people were confirmed had COVID. So I think that when you look at all of those numbers, I think that's the measuring stick that health officials, government officials use to decide. Okay, we're gonna go to a more full type opening from the
Mhm.
50. Um, of course, there are economic considerations as well. You have, like I told you, what was a spiraling. I think unemployment was about maybe 14% or so at that time, with the 40,000 unemployment claims that went to our national insurance scheme. So you want to have a situation where some of those people who are unemployed because there's certain businesses that are not open, you allow those businesses to open so that you at least be able to carry that number down and let some people be able to make money again, and because people need to eat. So I think that there's a very realistic point of view as well that government has to take. As our prime minister said a couple of days ago, um, heavy is the head that wears the crown in terms of leadership, and you have to make tough decisions. And that's one of those tough decisions. Obviously, there are people who are like, no, I don't think we should open back just yet. Let's wait a little longer. And in the best of circumstances, you would ideally like to do that, but it can't work all the time, and then you can't stay in that state all the time. The church, for example, we had some rumblings here in the church just about a week ago. There were some restrictions put on the church, additional restrictions, not using air conditioners and not and then physical distancing that was worked out to like 2 people in every pew. And no, they were kind of concerned because they want to know why supermarkets have so many people and they can't have more people. So there are a lot of social implications that come with all of the restrictions. It doesn't. It's not life as usual, obviously, for everybody.
Um, Speaking on the economic side of things, here in the US, we've definitely had a kind of, again, all over, America is everything. Um, uh, Sometimes we've had the stimulus checks that were sent out that were a boost to help people and, you know, stay home, pay some bills, you know, if you qualified for that. And various areas had rent protections, mortgage protections, so that when you were told to shelter in place, you had shelter, you didn't lose your shelter while sheltering. Have you guys had similar programs in terms of anything from like unemployment insurance to stimulus kind of checks to protections on rent and you know, housing mortgage payments?
Yeah, definitely. On the financial side, on the economic side, all of the banks and financial institutions, places where you would have had your mortgages, your loans, whether it's vehicle loans, whatever kind of loans, the majority of banks did an automatic, well, most of them automatic. Some you had to request it, 3 month moratorium on all loans. So people would not have basically paid loan payments since March for 3 months. And then they would review at the end of that 3 months. If you're still unemployed or whatever the case is, then you would perhaps get additional time along with that. So that was just the banks, the non-banking institutions, the ones that would also lend money, etc. And then in addition to that, government did something for the vulnerable, most vulnerable households. I believe it was not in your cases, I believe it was $1,600. It was more like I think it was $600 a month for vulnerable households, the most vulnerable households, to help people, you know, in terms of buying basics, etc. For businesses, small businesses, there was a grant that they had access to once they were paying their national insurance, etc. I believe it was $1,600 for small businesses to help keep them going. Because obviously there are some small businesses that would have closed. That's the reality. Not everybody's able to sustain going 3 months without any kind of income and no any kind of business, and people have rents to pay in terms of their businesses and malls or whatever. Um, so there was that stimulus. Then the most recent thing we had is something where they're encouraging people to buy government bonds through as in addition to what you're paid in terms of salaries,
Mhm.
to put a portion of your salary towards a bond. The percentage is based on how much you make. It's an optional it's an optional scheme. It's called the Barbados Optional Savings Scheme. And you can buy a bond for anything from like whatever you can put. If it's $20, or you can opt not to, in which case your that portion of your salary would be a bond up to that point, and then it's sold to the central bank if you decide that you don't want to opt in to have a bond. Any part of your salary is a bond. So, you know, we've had to get creative. Barbados is a highly dependent, tourism dependent country, and obviously our tourism has taken a very hard hit. We're still there are a number of cruise ships still in our port right now, but not with passengers. They're a lot of them have just have crew on them, and they've been making the circle through the port. You know, come in to get supplies, and then they go back out into out to sea. It's quite a sight to see. And when you could think of just like a whole bunch of cruise ships, just kind of like in a kind of a carousel, just kind of going in and going out each time, a few at a time. It's really something to see. But so that's our we're still getting something from that, obviously, but not if you had passengers on board those cruise ships.
Right.
So yeah, so from an economic point of view, that's kind of where we are right now. In terms of opening back to visitors, there's some discussion that has been going on in terms of how that will look. Rapid testing at the airport, testing before people leave their destinations. The hotels here are looking at ways of kind of containing visitors when they come to screen and to make sure that, you know, and sometimes if they can't go off plant, etc. So the different ways they're looking at to get creative.
That that sounds like a really smart response. What has been the reaction amongst the population in regards to the stay-at-home measures, the economic support, things like that? Because, you know, we've had massive, we had some, I would say massive, we had protests, you know, before the current ones where people were like, hey, I need to be able to get to work. I need to be able to pay my bills. And while I think that they could easily be seen as people, placing economics before health, I also think that an important through line to understand on this is when when you have economic instability, that is a health impact. And it may not have always been worded correctly, but I definitely had some sympathy for protesters that were out there going, let me get back to my life, because it's scary when you don't have any idea of what's coming down the line in terms of, finances. What has been the response in Barbados to the steps that you guys have taken to these various measures?
Well, I've seen a lot of what you're talking about. I've seen people protesting and even getting assaulted at stores in America and so on for people not wanting to wear masks and that kind of thing. And
That's
wearing a
unacceptable.
wearing masks and is not that's not something that fits in with our culture. But people have been generally understanding of that's what's required. That's what we do. We haven't had any protests around that particular thing in terms of people not wanting to wear masks, and they understand the curfew as well. I think Barbados has been at its quietest. Most people, not that you still have some pockets of people, some mostly young people who would, oh, well, look, I'm outside kind of thing. But most people have been most people adhere to the curfew. Most people would have been inside. You could hear pin drop. Most districts. Not again, it's not wasn't a perfect situation. Obviously, you had different pockets of people, minority, doing foolishness or outside just to be outside. But most people were compliant. I think because this is something that none of us has ever experienced. There was a certain fear element and an uncertainty element, so everybody kind of wanted to get it right. I think one of the scarier parts came for us when we introduced an alphabet system to in terms of surnames. So when you can go to the supermarket and when you could go to the bank. So in other words, people with the last names A and B would go on Mondays and et cetera, Monday.
Mm-hmm.
And when that started, what happened is that you had a situation, you had long lines, and I've seen this in America too, long lines of people snaking around the whole building and sometimes, really, really long distances. And that was a bit of a concern because people were like, and distancing was kind of like not being adhered to at that time. So there was a lot of concern at that time that you might have had some spread. And fortunately, we've come through that, and the numbers have not gone crazy when you consider since March that we're only at 96, and majority of those cases are people who've come in on flight as opposed to local spread or community spread that we're aware of. Again, you can only go with what's confirmed, the people that come in. But the majority of those, I would say maybe 75% of that 96 right now, or more than that 75% are people who came in on flights or on cruise ships.
I think the last question I really have on this is living, when you're in the US, we are kind of blind to a lot of the outside news and perspectives that are happening. And I think sometimes that's just because there is a lot of US. Um, but I think it's something that, I would certainly love to improve on. How would you say, what is your perspective of the events that have been unfolding in the US from someone in Barbados?
Um, we tend to pay a lot of attention to what happens in the US. Obviously, no Black Lives Matter. We actually had a protest here today. We had one last week, which was a smaller scale, not too far from the US Embassy here. And then we had another one here through the major city in Bridgetown. That one was about the limit was supposed to be 250 people. The one today through the streets, and peaceful because obviously we're not experiencing the same things that um, Black people in America will be experiencing right now. Yeah, we do have reports of police brutality here, but nothing on the scale of what you would experience in terms of deaths and that kind of thing in America. Um, but we do observe what happens in America a lot, and that sometimes influences the way how we think and how we approach sometimes to do things the opposite way if that's required. Not to necessarily copy, because it's not everything that America is doing right now that is necessarily something that you would want to copy. But where there are things that we think that can work, for example, our local Ministry of Health took a lot of guidance from the CDC in America in terms of when we first started wearing masks for the first time, because that was one of those kind of iffy things early on. The first thing that was going out is that no, you don't need to wear a mask. And then when CDC changed their stance, our local Ministry of Health changed their stance. So there are things that we would observe that we would incorporate, and then some other things that we would not,
Right.
basically, depending on if it is something beneficial and if it makes sense, really.
Well, I have absolutely had a pleasure talking to you today. Thank you so much for joining us here on You Talk It. We live it at Rome. Again, this is Mr. Ryan Broome. I hope enjoy the sun. Go out to the beach for me and take a picture and send it. I'm here in Oregon. We got rain. That's all we're doing. So I need a beach. I need a beach to see.
Well, when the flights start back, then you know where to come.
Exactly. Exactly. All right. Thank you for now, and I hope you
You're
have a great
welcome.
rest of your day.
You too. Okay,
All
bye.
right. Bye.